Ever experienced a sharp shooting pain that radiates from your lower back down throughout your legs? Then you might be familiar with sciatica, a common yet often misunderstood condition that requires identifying the root cause of the issue to fix it. My name is Faris Solomon. I got my degree in the study of human movement, and I will go over what sciatica is, how it happens, and most importantly, how it can be treated. Let's go. Sciatica isn't a diagnosis in itself. It's usually a symptom of a deeper issue. It refers to pain that follows the sciatic nerve, which is the longest nerve in the human body, running from your lower back, hips, butt, and down each leg. The root cause of sciatica will change the approach required to fix it. The two most common causes are a bulged disc, which can compress the nerve roots that form the sciatic nerve, and Piriformis Syndrome, which is when the piriformis muscle compresses the sciatic nerve, which can happen from overuse, muscle tightness, and muscle spasms. The result is pain, tingling, and numbness in the affected leg. Alright, how can you tell if an exercise is helping or hurting? Well, to start, all exercises should be comfortable and not actively making the condition worse. An easy way to tell is if the pain, tingling, and numbness continue to travel further down along the leg, then the movement is irritating the nerve further. On the other hand, if those symptoms travel up and out of your leg, hip, and more so towards your lower back, then we're moving in the right direction. I'll have the exercise program separated into two parts. The first part will address Piriformis Syndrome, and the second part will address bulged discs. Let's get started. The first movement is a pigeon pose. Sit down on the floor and gently get into a 90-degree position with your affected leg. Slowly lean forward while keeping your back straight. Hold the stretch for 30 to 60 seconds. That's 1 rep. Go for 3 reps. This stretches the piriformis, glute max, and hip flexors, helping relieve tension of the sciatic nerve. The second movement is nerve glides. Lay down on your back, bend your affected leg, and grab right behind the knee. Pull it toward your chest and slowly extend your leg as far as you can tolerate. Hold for 5 seconds and relax. Now with each rep, try to extend your leg a bit further. Keep going for 2 sets of 10 reps. This lowers compression on the sciatic nerve to alleviate symptoms. The third movement is a Piriformis Stretch. Lay down on your back, bend your affected leg, and pull the knee towards your chest. Then pull it up and over towards your other shoulder. Hold the stretch for 30 to 60 seconds. That's 1 rep. Go for 3 reps. This stretch targets the piriformis muscle, which relieves pressure on the sciatic nerve. The first movement is a figure 4 stretch. Lay down on your back with the legs bent. Cross your affected leg over the other one. Grab behind your knee and pull towards your chest. Hold the stretch for 30 to 60 seconds. That's 1 rep. Go for 3 reps. This improves flexibility by stretching the piriformis, hips, glutes, and lower back. The second movement is decompression. Go to the edge of a bed or a bench. Use a towel or a pillow for comfort and lean over the bench, bend your knees, and relax. Stay in that relaxed position for 60 seconds. That's 1 rep. Go for 2 reps. This decompresses the spine, reducing tension. The third movement is a Cobra pose. Lay down on your stomach. Place your hands under your shoulders, elbows close to your body. Press into your hands to lift your chest off the floor, extending your spine. Keep your hips and legs relaxed. Hold for 10 seconds and gently lower back down. Repeat for 2 sets of 10 reps. This strengthens the lower back and stretches the abdominal muscles while extending the spine to put the bulged disc back. The good news is that most people with sciatica don't end up needing surgery. Initial relief is usually noticed within 2 to 4 weeks as the inflammation and muscle tension are addressed. As for a full fix, the average time it takes is 6 weeks. Of course, consistency is key here, so try to do the exercises 3 to 5 times a week, while also listening to your body to avoid any movement that makes the pain worse. Now, to prevent sciatica from reoccurring down the line, a good approach is to exercise regularly, particularly focusing on core strength, while maintaining a good level of flexibility to reduce the risk of injury while promoting good posture. While sciatica is a painful and annoying condition, with the right approach, it can be fixed. Remember to keep it simple, avoid movements that make the pain worse, and stay consistent to achieve long-term relief. So as always, stay active and mindful.